I'm going to be talking about shoulder imaging following our shoulder series. Now, many of you must be thinking, if I have shoulder pain, do I need an image or an x-ray? Now, that's a very valid question, and I'm going to try to answer in this video. Diagnostic imaging is a useful resource for physiotherapists or another healthcare provider. However, it does not mean that everyone that has shoulder pain need imaging. There is a poor correlation between scans and shoulder pain. It is very common to have some sort of shoulder pathology, so changes to your structure, without having any pain. In the next section, I'm going to talk about research and different studies. So Minagwa and his colleagues looked at 664 individuals and found that 22% of them had some sort of rotator cuff tear. Now, the most interesting finding of that study was that people without pain had twice as many tears than the ones with pain. A study by Barreto and his colleagues looked at 123 subjects with one side shoulder pain. However, they scanned both sides, so painful and not painful side. Interestingly, there was no difference in findings of those images. So the painful and not painful shoulder looked exactly the same. To sum this all up, shoulder imaging is not very specific to your pain. So when do you need a scan? First of all, you would need an assessment by a physiotherapist or by some sort of other healthcare provider to determine that. As a rule of thumb, patients that sustained an injury and developed pain with weakness would benefit from an image. The reason for that these people may need a surgery. However, saying that, this is quite rare, and most of the time shoulder pain improves with exercises and physiotherapy. What are advantages of imaging? First, it helps us with diagnosis. Secondly, helps us to be specific with our conservative or non-invasive treatment. Thirdly, it can help us with more invasive treatment like image-guided injections or surgery itself. What are the different modalities for imaging? X-ray. X-ray is initial modality and performed most commonly. It helps us to evaluate bony structures with limited vision of soft tissue. X-ray is a primary image to rule out any fractures after trauma. However, it may not be sensitive enough to pick very small fractures, like avulsion type fractures, where a tendon pulls a piece of bone. MRI scan is better for that, but we're going to talk about it later on. Quite regularly, shoulder x-rays are performed on shoulder pain with a bit of restriction. Now, x-ray can be useful to pick arthritic changes. These are normal age-related changes. It could help us to distinguish between joint problem and capsular problem. Now, capsular restriction is called frozen shoulder, or in other words, adhesive capsulitis. Thirdly, it could help us to find other problems like sarcomas or other cancers. Now, saying that, cancer is very rare in the shoulder, and you would present with other symptoms like you would feel unwell, you would lose weight, sweat at night. Occasionally, x-rays pick up calcium deposit in the tendons. Now, this is called calcific tendinopathy. These are usually incidental findings. Ultrasound scans. These are very useful for soft tissue problems, mainly rotator cuff issues. Now, rotator cuff is a group of 4 muscles. However, saying that, the issues tend to occur not in the muscle bit, but in the tendon. A tendon is a connection between muscle and a bone. Very commonly, tendons become thicker over time. This is called tendinopathy. Now, this is again a normal age-related change. Scans can also pick small tears. These are called partial thickness tears, or slightly bigger tears, which are called full thickness tears. It could also help us to find a completely torn tendons. MRI scans. Now, these are the best of both scans. They help us to find soft tissue problems and also bony abnormalities. It is slightly more sensitive than X-ray, therefore it can be used to pick those small avulsion type fractures that I mentioned before. But the main disadvantage of this modality is price. Not only these scans are more expensive to perform because you need to use an expensive machine, but also these scans need to be reported by a specialist radiologist. So in summary, imaging is a useful tool for people that sustained an injury and then develop shoulder pain. However, they're not that good for people that develop shoulder pain over time. As mentioned before, shoulder imaging is not very specific, and it doesn't really correlate to your pain. A lot of people carry some sort of structural problem in their shoulder without pain. Therefore, it's very difficult to make that link to your pain and image. Sometimes having an image on your painful shoulder can be damaging. Now, that's because if you're told you have some sort of tear in your shoulder, you may not use your shoulder or your arm and develop what is called kinesiophobia, so fear of movement. Over time you get weaker and your joint will become stiffer. Furthermore, conservative treatment may be negatively impacted by imaging. There's a general preconception that if you have a tear, you need a surgery. This may lead to poor compliance to physiotherapy and exercises, and you may end up surgery that you don't need in the first place. This, in turn, will make your recovery even longer. Now, thank you very much for watching this video. I hope you enjoyed it, and I hope I answered most of your questions. Please hit that like button if you did enjoy it, and please subscribe for more content. And I'll see you in the next video.